At the outset, I would like to thank the organizers, especially the ESN publications, who are responsible for conducting this third international symposium on multidisciplinary research. So I have attended more than 3 international symposiums, but they were all related to my own medical science. But this is peculiar and especially special multidisciplinary research. So I am very much happy. I also feel very happy to address the multidisciplinary research. So I am now addressing a kaleidoscopic audience, and I am going to talk about a disease which the chief guest has given some idea about the cancer. So it is also a kaleidoscopic disease. It is not a single disease, and it is not a single gene disease. It is a multiple gene and multiple factorial disease. So the title of this paper is Meta-analysis of chemotherapy versus the phytotherapy of cancer, an overview. So why I have compared this chemotherapy with phytotherapy? Because chemotherapy has got so much of side effects, and as soon as I reached Colombo airport and come to Kandy, I saw that the green atmosphere and environment. Now this beautiful greenery and the atmosphere is enough to cure the cancer, whereas the people think that by admitting their patients or by themselves going to the big hospitals like Apollo and all, they think that they will be getting cured by the chemotherapeutic drugs. So inside the concrete jungles, they don't have any aesthetic sense of pleasure. So that itself will take away the cure rate. And I am sure that by chemotherapy it is not that much 100% successful. Whereas through phytotherapy, you can cure the patients. That is why so many people are going away from the chemotherapeutic side. So many people have given the cancer definition, and I am caught by 2 definitions, one given by Newland and another one by Madeline. So everybody thinks about the life only, but this author Selvin Newland, in his book How We Die, he has given a beautiful description about the cancer, how the cancer cell behave. You can read this passage. So it is a barn-burning expedition. A cancer cell, once transformed from a normal cell, it will multiply, it will proliferate very intensively when compared to the normal cell's division. And it is a barn-burning expedition, and it will, just like a terrorist, it will not obey the normal rules of our body or your health. The second definition is given by Madeline Nash. So that is also quite interesting, how a cancer cell is able to develop from a normal cell by genic mutations, or which is induced in turn by the environmental carcinogenic chemicals or the pro-carcinogens, and how it develops, multiplies, and it severs the connection from the moorings, that is from the region of origin, that is called the primary site. So any tumor that develops in a particular tissue or in a particular organ is called a primary site. So after some time, after reaching a threshold size limit, they want to go away from the primary site. That is why when the cancer cells move, it will move through blood as well as from your lymph fluid. So they come away from the primary site, and that is given by a term called metastasis. And that is called metastasis. That is, they will go not randomly. It is not a stochastic process. They will go by a tropic movement. So they go and settle in specific tissues like your liver, brain, bone, ovary, peritoneal cavity. So like that, the secondary populations of cancers are established in specific tissues. So that is called the process of metastasis. So that is given by this Madeline Nash, and the next passage is also interesting. Until 1990 or 2000, nobody is talking about the prevention strategies of cancer. So it is given by the author, that is Baylor, USA. He himself has said that it was indubitably true that prevention of cancer as a strategy had been neglected by the National Cancer Institute, USA. And in 1960s and 70s, it did not witness so much a different both of approaches to prevention that focused upon two aspects. One is an environmental aspect, another one is a lifestyle causes of cancer. Now it's a common knowledge. It's a common knowledge. Yes. It's a common knowledge that environment and the lifestyle are the two important factors for cancer origin, or the transformation of a normal cell into a cancer. So everybody should know what is the history of cancer and what is the history of your World War. So they have got a connection. History of chemotherapy. So the chemotherapy evolved only after the World War #1. So when the World War #1 started using this mustard agent or mustard gas, and in World War II is also they were using this mustard agent or mustard gas, colchicine. So many soldiers were affected, and they found that in the soldiers' body, the WBC count, so it has drastically reduced. Then only they came to know that this is the particular mustard agent which can able to reduce the cells number. So how it can be applied to blood leukemia. So blood leukemia is nothing but the unprecedented numbers increase of WBCs, not abnormal WBCs. Not normal WBCs. If normal WBCs were increase means we call it as leukocytes. Whereas abnormal WBCs, cancerous WBCs, when they increase only, we call it by the term the leukemia. We follow. So from that only, so 1946 is the year when the chemotherapeutic drug, that is the mustard agent in the form of a drug, was employed to cure hematologic cancer patients. So that is the history. And likewise, what is the history of cancer disease? So it dates back, or it is as old as the mummies' age. So even from the age of mummies, the cancer was prevailing. When some mummies' bodies were analyzed, they found that the mummies in Egyptian tombs, they suffered the cancer disease. So that much old this disease is. So when we talk about cancer, we have to talk about the hematological cancer, which is referring to your blood cancer and the lymphoma, affecting the blood cells and the lymphocytes. And the other one is called the solid type of cancer, which is affecting all our tissues. Will you know that any body tissue can be affected by the cancer? Even your nails can be affected by cancer. Even your nails can be affected by cancer. Whereas only one tissue, remember, only one tissue in our body can resist the cancer. And cancer cannot develop that much frequently in that tissue, which is called cartilage. This is called cartilage. It can come into bone, but not the cartilage. That is why in Canada, one group of researchers are doing research in cartilage. And the cartilage research is going on, and they have found out a factor which is inhibiting the angiogenesis. That is formation of blood vessels, new blood vessels which supply all the essential growth factors or the proteinaceous factors for the further proliferation of a solid tumor. So when you see the solid tumor, it will have three regions. The central core is a dead zone where the cells, cancer cells will have died by necrosis. That is called cell death. Whereas in the middle portion, the division is not as much, as fast as they do spontaneously. Whereas in the peripheral portion, they are very rapid. The proliferation is very rapid. So what is the thing in Multiplication means if you allow one particular cancer cell after transformation to undergo the division process, it will reach by 10 days. How many? Can you tell me? So after 10 days, one cancer cell, if there is no factors interrupting its division, it will multiply into 10 lakhs and 46 thousands of cells. One cancer cell, without any inhibiting factors or drugs, it will multiply within 10 days into 10 lakhs and 46 thousands of cells. So it is a calculation given by US authorities only. So what are the determinants of cancer disease? So these are the three determinants. One is a risk factor of individuals. So I said lifestyle is the most important basis for cancer origin. So the risk factors, everybody knows that we are all having some risk factors. So among the small gathering, how many of you can smoke cigarette? Anybody? Anybody who is taking cigarette, smoke? And anybody who is taking alcohol? Raise your hands. Don't be shy or any. So good. It's a good audience. Cancer will never come to this audience. So many risk factors are operating in our environment, and our lifestyle is also responsible for such risk factors. The other one is co-carcinogens. Co-carcinogens means as long as they remain in the environment, they will not do any harm. Once these carcinogens enter into your body inside, that is in the in vivo condition, they will be converted into a real carcinogens. They will be converted. So in all lectures I will tell you where from you are getting the carcinogens, or when from you are getting the co-carcinogens in your body. Right from your birth. Right from your birth, from the childhood itself, you are taking the co-carcinogens. You know, certain carcinogens like dioxins or the BPH, polychloride biphenyl chemicals. All these can pass through the placental barriers. So when your mother is carrying the child in the womb itself, the vertical transmission of several carcinogenic, co-carcinogenic substances may be going inside the developing baby. So then they are accumulating. One person in research in USA has given statistical data that before a cancer pronouncement occurs, the person has accumulated 1 lakh mutations. 1 lakh mutations in the genome. So it's really true. But at what time, at what number of the mutations the person develops or manifests the disease, we don't know. So that much importance the environment we have to take. The next one is a carcinogens exposure. Some of them are not only mutagenic, they are carcinogenic. Even you know that there is a parasite called Helicobacter pylori. We all got that just like E. coli, Escherichia coli, which is living inside our inside your intestine. This Helicobacter pylori is also there. And nowadays we have got drugs like probiotics. You would have heard the lactobacillus. So before 50 years there was no lactobacillus in the pharmacy shops. Now they are giving. Why? Because the probiotic population will outnumber when they outnumber the actual carcinogenic chemicals or carcinogenic parasites, will be cured. So Helicobacter pylori is considered as a carcinogen. It can cause cancer. It can cause the stomach or the colorectal cancers. So what are the cancer cell functionalities? So cancer cells can be traced by three functionalities or three profiles. One is a metabolic profile. One is a metabolic profile, that is being carried out in all hospitals. Whenever a cancer patient is admitted, they will just see the alkaline phosphatase, an enzyme which is a marker. Likewise, an LDH, lactic dehydrogenase, is a marker. And even in recent papers, I suggest that not only the markers so far you have diagnosed is important, even the glucose and lactic acid is very important. So likewise, the metabolites are very important, and that is the determinants, and they can also give an indication about your cancer. The next one is the proteomics, the body proteins. So inside our body, according to Human Genome Project, 30,000 functional genes are synthesizing about 60,000 proteins. Your body is a cellular machinery. So it is synthesizing 60,000 proteins. Think of it. Some of them are pro-inflammatory, some of them are anti-inflammatory. That is why the research is going on. What are all the anti-inflammatory proteins like interferons, gamma, alpha, beta? So like that, the erythropoietin. All these are doing some good things to you. That is why you are living in health. Whereas if the same proteins become pro-inflammatory, all of us will suffer due to some malicious diseases or malignant diseases. Likewise, the next one is genomics. And genomics has come now to hospitals also. As our chief guest has told, the breast cancer, it means they will just do the, in hospitals now, the BRCA1, BRCA2, these are the marker genes, and another one is MSX, another one is TP53. They are all suppressor genes. They are all in inaction. Whenever a suppressor gene becomes active, you will get cancer. Whenever a silent pro-oncogene becomes oncogene, active oncogene, then you will get cancer. So that is why the genomics has become an important criteria in diagnosis of the prognosis of the cancer. So these are all the risk factors. I have promoted about 6 cancer theses, PhD candidates. So everybody, I asked them to do the epidemiological studies besides histopathology, ultraspectral pathology and all. And from them, they are the students who have given me the impetus to write books on cancer. So these are all the risk factors. Kindly read it and carry it in your mind. Some of the risk factors are endogenous, within your body. Some of them are exogenous, from the environment. So we may think that the endogenous factors will not operate. Definitely. I am standing before you. I am 70 years old. Do you think that I am a normal man? No. When I went to the Anderson Diagnostic Laboratory, I found that I am also having slight problem of BPH. You know what is a BPH? In all old people, the prostate enlargement is a must. Prostate enlargement will come. So if you allow that to continue, then it will end up in prostate cancer also. So aging is a very good prognostic factor for the cancer. So likewise your hormones. In all menopausal women only, the chief guest has addressed, the breast cancer is rampant. So in menopausal stage, your estrogen is off, your ovary is functionless vestige. But the other, even in the mammary gland itself, the self-synthesis of estrogen will take place. And such non-organ specific estrogens will stimulate the cells to undergo the rapid proliferation. So that is why the endogenous factors are also important. So if you don't take any antioxidant food, then it is called another prognostic factor. Nowadays, that is why even the pharmacy shops, the drugs are going with the fortified vitamins, or fortified with vitamin E, or vitamin D, or with retinoic acid, alpha lipoic acid, like that. So these are all the protectants. They will protect you from the body from cancer. So these are all the general attributes of cancer which I have taken it from a big book published in 1960s by Brasse and Mirsky. And you can read this. That is uncontrolled cell division, already you know that. Autonomous growth, heritability and transplantability. If you transplant a cancer tissue from a cancer patient to another man, definitely the recipient will also suffer. Then altered cell surface. So the cell surface of the cancer cells is different from your normal cell surface. They have got a different biochemical composition of glycolipids, glycoproteins, and the proteoglycans. Then dedifferentiation. Dedifferentiation means all cancer cells are comparable to embryonic cells. What your embryonic cells will do? Embryonic cells only will rapidly grow. So that much rapid growth is going on. So this is the Hannigan and Wiener. So he has given the 6 cardinal features of cancer, cardinal characteristics that you can also read. This is published in 2011. So this is the different types of chemotherapy and the side effects. So if you go to the medical books, oncology books written by so many authors, even Indian authors have written the books, oncology books, and you can find out the references as well as the research was carried out in different side effects of cancer. So now I come to the phytotherapy. So these are all the powerful weapons to fight the cancer. So they are in the form of phytochemical compounds like flavonoids or carotenoids, beta carotenes, terpenoids or terpenes. Then your different types of tannins, even your green tea and your normal tea contains the monophenol, polyphenols and tannins. Your wine contains the tannins. Then your phytosterols, simple your beans and all your green vegetables, the cruciferous vegetables, they are all protecting your body from cancer because they are endowed with phytosterols. That is why whenever I address my students or the people in universities, whenever you go and wish your friends or your relatives, don't go with a bouquet, go with a broccoli. You know what is a broccoli? How many of you take the broccoli or the mushrooms? Now it has become a table menu in my house, and I insist all others whom I am meeting, take 1 mushroom daily for ladies. Take broccoli every week. So that much Dr. Ganna, one nutrition specialist, has written. So what happens when your body takes so much of vegetables, then green teas, then your mushrooms, then your eggs, and avoid the chickens, muttons, red meat and all, your body will politely say thank you and remain in high energy level when compared to others. So when you take some phytochemical substances, they will also act upon the enzymes which promote the cancer. 2 particular enzymes which are promoting cancer, one is aromatase, another is cyclooxygenase 2. So even your simple that is what is your aspirin? Your aspirin, diclofenac sodium. Then your ananthracene. All these are pain relievers. They are all good drugs to fight against cancer. If you take in the optimum dosage, it is written in the book. I am not telling or I am not suggesting because I am not a doctor. I am only a researcher. So that is preventing the formation of cancers because they can prevent the COX-2, cyclooxygenase activity 2. As a result, some of the cancer-promoting free fatty acids will not be promoted. So these are the flax seeds. So this is this I have to. How many of you know what is a flax seed? Raise your hands. So it has become a cancer diet. It is not now becoming a diet. Even in 1950s, one doctor, Budwig, she is a lady. She has cured 100 metastatic cancer patients by giving her diet that is called Budwig's diet. This is the flax seeds plus cheese plus.
I'm not conclusion and finding these other people are
Okay. So this is with reference to mushrooms. So these are all research papers submitted by my students. So I come to the conclusion now. So the doctor of the future will give no medicine, but will interest the patients in the care of human craving diet and in the cause and prevention of the disease. And that is given by Thomas Alva Edison before 100 years. Before 100 years, Thomas Alva Edison has suggested that the phytochemistry is the remedy for the cancer. And Paul Ehrlich, he only coined the term. What is called the bullet, magic bullets. So we are not in a boundless sea, that is in the cancer sea. Many Columbuses are searching solutions to find the English boundless sea. Until then, whatever they try with the chemotherapy, whatever be your drugs, though they are called the magic bullets, I can say they are not magic bullets really, they are only the tragic bullets. Thank you.
Thank you so much, sir.